etymology of that particular wording itself is a little different. In the sense, uh, it has two components. Re. Re means which is a prefix, and the search is a verb. So when both re and search combine together to form research, it becomes a
Finding something.
what does it become? The two syllables re, which is a prefix, and search, which is a it becomes a
Meaning to examine close. Research.
it becomes a noun. Okay.
Okay,
So
sir.
meaning to examine closely and carefully, together they form a noun describing a careful, systematic patient study and investigation in some field of knowledge. So research is not alone for our medical thing. It can be done in any field. So when the meaning of the word research is a careful, systematic, in our context, it is a patient study and investigation in some field of knowledge undertaken to establish facts or principles. Okay? And research is done with the help of study, experiment, observation, analysis, comparison, and reasoning. These are all the components of research. So it seeks predictions of events and explanations and relationship to theories for them. So when you undertake a research study to find an answer to a question, you are implying that the process of that research is undertaken within the framework of a set philosophies, that is, the research approaches, and uses procedures, methods, and techniques that have been tested for their validity and reliability and designed to be unbiased and objective. These are the three important concepts or the dogmas for doing a research. One is it is undertaken within the framework of set philosophies, and it uses procedures, methods which have their validity and reliability, and it is unbiased and objective. It is open that you can see what is being done without being subjective. So here the philosophies mean a qualitative, quantitative, and academic discipline in which you have been trained. The validity means the correct procedure that has been applied to find the answer, and the reliability refers to the quality of measurement of procedure and their response repeatability. The unbiased and objective means that you have taken each step in an unbiased manner and draw each conclusion to the best of your ability and without introducing your own vested interest. This is very, very important. For example, this sort of mistakes or deliberate twisting is done in pharma industries. For example, when you want to introduce a new drug, what the pharma industries do, they go and catch hold of some researchers, prepare the medicine, and go and give it to very popular leading doctors who have a very heavy practice, and then ask them to give it on a trial basis to patients, and then write all the goods about that particular drug. They completely conceal the side effects or the unwanted effects, and they published a paper also saying that, for example, for reducing cholesterol, statins are the best drugs. That was the publication that was made. But later on, people found out that statins have a lot of side effects like myopathy, renal problem, and other unwanted side effects are there, which were not exposed initially. So what happens? The first study becomes a biased study, and it gives you a false impression that statin is supposed to be a wonder drug for reducing your cholesterol and preventing cardiac complications of atheroma and all those things. But after usage for about 3 to 5 years, people, when they come back with some complications, other people, competitors, they try to expose this particular problem of that drug, and they publish papers saying that these are all the complications, and they try to come out with a new molecule, and they will try to promote it in the same way and say that this drug is the only drug that we can use. So this sort of bias and vested interest should not be there. That is the main important thing about research study. So three important concepts or dogmas to be followed are within the framework of set philosophies. It should be valuable and reliable, and it should have unbiased and objective method of doing it. So adhering to these three criteria mentioned above enables the process to be called as real research. Now, how is medical research classified? As you rightly said, can be primary and secondary. Secondary is something what you review at what already has been done by somebody else, which can be in the form of systematic review or narrative review and meta-analysis. This is the way many people have when they say have 100 publication, 200 publication. They don't do any research on their own. They simply go through the internet, put a search engine word like a few terminologies, collect all the 50 or 60 articles that have come in, and then try to publish a paper on that. This sort of thing is only secondary, and this is mainly to review work that has already been done. But the primary research is one where you start doing something on your own, which can be a basic research, clinical research, or epidemiological research. And in clinical trials, it can be experimental and observational. And in basic research, it can be theoretical or applied. And what are the objectives of research? To discover new facts, verify and test important facts that have already been published, analyze an event, process, or phenomenon to understand the cause and effect of relationship, develop new scientific tools or concepts or theories, find solution to scientific or non-scientific social problems, overcome or solve the problems occurring in our everyday life. Everything can be done by doing a research. What are the steps in the research? This is the way it has to be written. This is the research methodology. The answer is first identify the problem, formulate a research question, and refine that research question with a review of literature, formulate a hypothesis and research objective, decide what is the sample or the study population you want to use, decide on the design of the study and methodology, then write a protocol, collect data, analyze the data, apply statistical significance, and finally complete your paper and then try to publish it. So that is the last step that I have not mentioned here. So writing and completing the paper and publishing is the last step in the research. So these are all, first you must know what problem you want to take up. Now already for Priya, they have given the topic, comparison between two techniques for relieving pain. But you can think of a new normal technique instead of nerve blocks. Is there any other way of giving a pain relief by another drug or something new which is not already been used in practice? The nerve block and the facial compartment block all have been tried by so many people.
Yes.
Whereas if you do something new, that becomes a original result. So you can identify whether you are going to repeat a process that has been done by somebody and find some improvement to that particular process, or whether you are going to introduce something new. That is the first question that you have to do when you want to involve yourself in research. Identify a problem, formulate a question. My topic of research, is it going to be useful, or is it going to highlight some unwanted effect of something? Like that, you must formulate the question. Then you to search for the literature, whether somebody has done similar work or anybody has published anything. So review of literature is the third step. Then based on that, you form a hypothesis, whether my hypothesis is going to be proved or that is going to be a null hypothesis or a alternate hypothesis. And then what are the objectives of my research? Then you decide the population or sample in whom you are going to try that. Decide the study design, whether it is quantitative, qualitative, or a mixed methodology. Then the protocol, then collecting data and analyzing the data. Okay. So the formulating the for the formulating the research question, you must have this acronym, FINER. Whether the for topic that you are taking is feasible, whether it is investigating, interesting to investigate, whether something new is there or not, and what I'm going to do, is it ethical or not, and whether it is relevant to the particular population that I am going to try in that. And once you do take that into that, you go into this acronym PICOT, what she mentioned, that is what population you are going to do the research, and what intervention you are going to try, and what is the comparison of any previous treatment that has been tried, and what is the outcome between the older thing and your trying this thing, and what is the time at which it was done. So the example here I am giving is format population interest intervention, and compare the groups, and then see the outcome. That becomes PICO. And often timing added to that, indicating the time frame in which the study will be completed. So the example for here is, supposing a patient has a pneumonia, community acquired or ventilator acquired, and you give a treatment with two different drugs. That is called the intervention. And you can compare this intervention with the older drug that was used, and then see whether the hospital stay was reduced or not. So like that, you can the outcome, how many people survived and how many people died, and what was the total duration of the stay. So if you take all these things into that, this category will come into that. So this is the next step that you want to follow. And the importance of review of literature is that you will help to find the um, uh, literature will help to determine to what extent the issue or research has been previously done. Also relevant studies as well as the methods used with, or whether you can change from that method and do something alteration, and refine research question. So by going through the literature, you can see whether you can alter the question itself, the initial question that you wanted to pass, and put the project and methodology into a relevant context. So that is the purpose of review of literature. And then form the hypothesis, whether, for example, the research study comparing treatment X versus treatment Y for pneumonia, the same example that is given in the earlier one. The experimental group would be treatment X, that one particular antibiotic, and the control group will be treatment Y. So you have two groups where you compare, and you fix up that my particular antibiotic is going to be useful. It is going to be much easier to treat compared to the other group. So that is the hypothesis that you form. If it is proved, it becomes the alternate hypothesis. If it is not proved, it becomes the null hypothesis. So that is how the hypothesis has to be formed next. And then the types of hypotheses are deductive, inductive, and in the deductive one, you have null and alternate method. And decide the study population in the setting. You have a inclusion exclusion criteria. This is the first thing. So after selecting the population, you should say the distribution. How many men will be there? How many women will be there? What will be their age? So all those details are given, what height, weight if necessary. And after giving that, you must say who are all the people who are included and who are all the people not included or excluded. Sample size, which is very, very important. Larger the sample size, you get a better result. Smaller the size, it will be more uncertainty will be there. So adequate sample size has to be calculated. This is the next step in that. And types of research design can be qualitative and quantitative or mixed. And in the quantitative, you have observational, which are case study, case control, and cohort and longitudinal studies. Whereas in experimental, you do control trials and diagnostic tests. So here we use a particular technique or a drug and do a real experiment. Whereas here you do the already done work with analysis of that, and write the protocol You should contain the background information, ethical aspects, study design, study procedures, method of anesthesia, statistical evaluation, and administrative issues and references. All this should come in the protocol. And what is the next step after writing the protocol? Once it is ready and approved by the ethical committee, then you go for informed consent from the patient, and also the documents required should be submitted to the ethical committee for approval. And how to collect the data? Once protocol is finalized, data should be collected. Data should be legibly filled and they should be fully completed. Ethical issues must be taken care of from the beginning to the end of the study. In drug trials, care must be taken to document details of even adverse events also or complications, and proper documentation throughout the study important to ensure credibility of the data. And of course, data, she gave the details as what are all the types of data, continuous, discrete, and all that. Whether you mention or not, an overall idea about the data is enough to complete the answer. And the final step in the research data is data should be scrutinized for internal consistency and external validity, and it should be analyzed using the already decided data management plan. This is where the test, the chi-square test or the student t-test and all those things will come. But even if you don't write it, doesn't matter, but it is analyzed using statistical methods. If you use that one particular word, that is more than enough. So once you have done all the analysis, you come to the conclusion and then write your report and then make it ready for publication. Now there can be some dishonesty in research, as I said earlier. So what are all the dishonesty? Plagiarism should be avoided. You should not verbatim copy what somebody else has already done and write it again. Fabrication and falsification to attain your hypothesis. Supposing you say this particular drug is very good for treating BP, and you have decided that you should not, even if the BP is not reduced in 25% of the population, you should not alter your data and say it control the BP in 98%. You should not give such false values in data. And non-publication of data, also called cooking data, faulty data gathering process, and poor data storage and retention, misleading authorship. So if multiple people are doing the research, there should be the one lead author who is mainly involved with others supporting him. So you should decide who is the primary author and who are all the supporting authors. And these are all the areas where your mistakes can happen. Okay? So this is what is, this way of writing is more than enough for this particular method. And of course, now people are being encouraged to do or going for research, and many conferences when you go, there is a separate workshop on research methodology and paper submission, dissertation, and all those things. Okay, so from that angle, this 9 or 10 questions in this fashion, if you answer, I think your answer will be much appreciated, and you can save time also by not writing the unwanted things. Not the unwanted, more detailed things about the individual subdivisions of the topic.
Okay, sir.
Okay. Shall we close?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Kamakshi? Not there. Okay. Thank you. Good night.
Thank you,
Thank you,
sir.
sir. Good night,
Thank you,
sir.
sir.
Thank
Thank
you,
you,
sir.
sir.